Patient is a 43-year-old mother who's experiencing pain and limited range of motion when performing a fisted position following carpal tunnel surgery 12 weeks ago. Her problem area is holding a brush for grooming activities each morning. Her job requires her to look professional, and she wants to be able to gain function to independently brush her hair in order to get ready for work. NMES is being recommended for modulation of pain and gaining range of motion back. The motion being targeted is finger flexion, so the active electrode is going to be placed at the center of the anterior forearm of the affected hand over the flexor digitorum area. She has already been tested and found to have normal intact sensation. This modality cannot be used over the thoracic or carotid sinus regions. She does not have a pacemaker or any form of internal device. She does not have a history of DVT or thrombosis, and she does not have cancer, infection, or hemorrhage in the area, and the patient is not pregnant. So the settings that would be set on the E-stim unit, the waveform would be done in an asymmetrical fashion since it's a smaller muscle area. The pulse duration would be set to 200 microseconds. The frequency would be 25 pulses per second to start, with a 1:3 ratio for the duty cycle, which would mean 10 seconds on and 30 seconds off. So we've already sensory tested her, and I'm going to assess skin integrity, and it's good. She has no excessive hair over the area, so we don't have to worry about removal of that. So would place the first one. Can you form a fist with this hand? So right here's the muscle belly. And the other one would come down. And I would make sure to double check the settings again before I turned the unit on. And the patient should feel a strong but comfortable tingle. So the electrodes have been placed, and I'll instruct the patient that when the unit's turned on, you should feel a strong but comfortable tingle with a muscle contraction. So this would facilitate finger flexion, which would allow her to hold the brush better in her hand to perform some grooming activities. So we would perform this treatment modality for 30 minutes. Or as long as she can tolerate. And then afterwards we would follow it with a functional activity once I removed the electrode. So I would ask her to try and hold the brush now, which she is able to do. And I would just instruct her of these formalities when using, if she were to use any of this at home as well.